if you're a senior, likely you have a medical condition that you're being treated with a medication. There are so many things that you have to consider when on several medications. But, some of the basics right off the bat is getting your prescriptions filled and refilled timely so you're not running out. You got to have the medications there to be able to take them. So that's a big piece of just getting the meds. Then you may want to have someone help you, possibly, or you could do it yourself, but get one of those little med organizers. They're relatively inexpensive, and just set them up every week. So you know exactly what you have. So you know what to reorder for the next week, or, set them up for the time of day that you need to take them. And it's also good then, if you have them set up that way, you'll know if you took your morning meds today or tonight or whatever the case is. You kind of have that plan already out there for you. So that's step one. I would say it's also good to keep a current updated medication list written out, the names of the drugs, how you're taking them, why you're taking them, to know exactly the medical conditions that are being treated by the drugs you're taking. Just having that kind of general thing, and share that list with someone who might be helping you if you need to go to the doctor or you end up in the ER for some reason. You have it handy so you don't have to guess, well, I think I take this. Well, and also include on that list any over-the-counter medications that you might be taking, whether it's every day or just on an as-needed basis. That can also help your caregivers and the professionals treating you know what's going on with you. I would say also to make sure that if you have a change in medication, that you kind of take a look at what you have at home and make sure if something's been discontinued, to make sure you get rid of it. Don't save it for a rainy day, or if you think you might need it later, or if you've got a friend that takes this medicine and that can use it, don't do that. That just complicates everything for everyone involved. It's real important for seniors to make sure that their overall health conditions are being treated, and that the seniors that are being treated are taking the medications as they are prescribed, because there's a lot to be said for managing your health care with managing your medications.
I think having a current list is so important. It's one of those things, because you may go into the doctor and they prescribe something and they don't have the current list, and knowing how those medications interact with one another and making sure that you should continue what you're doing and just do that medication reconciliation, and how important that is anytime you add or delete a medication.
Absolutely.
Yeah. And so, Angie, do you have any other advice on managing medication at home, or even more importantly, how a senior living community could help with that in managing medication?
Sure. Cindy, gosh, everything you're saying or what you just said speaks true to my heart right now. My grandfather has dementia, advancing dementia, has gotten worse over the past 5 to 6 years. And my mother was his primary caregiver, so managed a lot of that for him. And she passed away about a year ago, and it only took a couple of months for him to get very disorganized. And when we went into his home to check on him, make sure he was doing okay, he had meds in the kitchen cabinet. He had meds at a bedside table by his bed. He had meds at a table by his recliner in his living room. Didn't know what he was supposed to be taking, didn't have an accurate list, had expired medications. So everything you're saying is something that people need to do more so than I think we realize. Yeah. Having places like CarDon and independent living centers and assisted livings and rehab centers to help patients get their medications under control is so important. And one of the reasons I came to CarDon was because of all the resources they have available to our residents. We have, when patients come to us, we have an interdisciplinary team of nurses, therapists, social workers that can go over the medications with them. We can look at your meds at home versus what you were on at the hospital, and now what you're on in the community, to make sure there's no interactions, to make sure that everything that's ordered is something that you know what it is. We can talk through all those things with you. So we'll make sure that the residents are on everything that's needed so that it's organized and families are aware and everything's accurate. We also have pharmacists available at any time during your stay that can meet with loved ones or residents to go over any questions that you might have about any new medications, old medications, things like that. And then once you're ready to maybe move on to a different level of care, maybe an AL, independent living, or you're getting ready to go home, staff will sit down with you and go over those medications as well, just to make sure that you're ready to go, you're organized. We also have a Follow Me Home medication program where we can order all of your medications for you so that you have those at time of discharge. You'll be able to take them from the facility to home with you, so you don't have to stop at a pharmacy, which is such a huge benefit. Lastly, we have, which comes to mind, is we have a nurse that can call you once you get home just to make sure that you don't have any questions, that you got your meds filled, that you're taking them, that you put them in those little pill boxes and you're organized, you know what you're supposed to take when. So we have a lot of resources available.